Good afternoon. My name is Cindy Swatilane, co-founder of Sisters Empowerment Circle. It is an NPO that works with rural women, empowering rural women and around issues of education. Sisters Empowerment Circle is here in Ramakoka Stad to talk to women who are heading a foundation called Litlotlo Labotsilo Foundation. This is a foundation that seeks to empower women in the rural areas around issues of healthcare, around issues of dementia, and around issues of healthy eating.
COVID-19 has affected me at home a lot at home because some of my parents left their jobs and they are frustrated.
Hello there. We here in Brazil, ISTR, we are a national membership organization. We had to adapt, we had to adjust to the virtual world, to the online world, and we started finally delivering to all our members virtual activities and even our national fundraising conference that will take place every year in the city of São Paulo with almost 1,000 participants from all around Brazil. It went online, and with that we were able to start including people, bringing people together that would never have the means to come to São Paulo and to participate in our activities. Also, because of the pandemic last year, we started tracking donations. We went from fundraising to also promote and study giving in Brazil, and we created the COVID-19 donations monitor, a real-time online tracking platform that shows the number in reais and in dollars of how much Brazilians have given to organizations, to the government, on crowdfunding campaigns in order to fight the impact of the virus in Brazil.
Some ignore the homeless when walking down the streets, while others are unable to do so. As the winter advanced during the second wave of the pandemic, the thought of more than 7,000 homeless in Rome became unbearable to some, and a project of solidarity and mutual aid emerged from bottom up called Aquítate. Promoted by Arci Pianeto Sonoro, in very little time, more than 40 formal and informal organizations were involved, and about 280 volunteers became active in contrasting local challenges. From November 2020, the network of Aquítate handed out an estimated total of 800 pieces of donated clothing and essential goods, and a network of social kitchens prepared 400 meals distributed weekly. From February to April, a shelter was opened with the support of the municipality, providing sleeping accommodations and services to help 8 homeless in moving forward. Aquítate became self-sustainable thanks to a used clothing booth set up at a local market for fundraising that also helped in strengthening local involvement. The objective is to counteract homelessness so that no one lives on the streets anymore, and we are driven to help the invisibles of Rome in becoming once again an active part of society. To date, Aquítate has offered to almost 500 homeless people medical support, employment counseling, help in resident permit requests, and much more. Everyone has the right to receive protection and to access equal opportunities. It is with a change in attitude, when the community itself decides to take action and becomes a network of solidarity and mutual aid, that changes can be made and the dignity of the vulnerable preserved, and every homeless person you meet will feel the difference.
Greetings from Nigeria. Kazanka Comfort, the CEO of Hanson Foundation. We had a general fear about COVID-19 that seems to be unknown to us. Hanson Foundation focused on providing up-to-date information and preventive measures as decided by the Nigeria Center for Disease Control. The first impact of the pandemic was severely felt in our two income generating departments, microfinance and ICT. Microfinance as one of our challenges. There was restriction of movement during the first wave of the pandemic, and fear by our clients and field staff limited the number of loans we were able to collect. Our second challenge was on ICT. As an income generating activity, we relied on students' enrollment in this digital literacy program for its sustainability. But movements prevented many students from attending the training, and the low levels of income of parents also prevented them from paying the training fees for their works. One ICT service which we provided is the online registration for students to write the university qualifying exams. This exercise was severely affected. Funds were needed to upgrade our training platform and ensure reliable power source, which resulted to a solar grid. We accessed small grants from the Association for Progressive Communications, Internet Society, and Project 48. Project 48 was devoted to promote ICT inclusions for people with disabilities. In conclusion, it is interesting and gratifying that ICT is playing a central role in the resilience we experienced. The recognition of ICT as an enabler of income growth and development is gaining recognition in government cycles. We will continue to explore how to deploy ICT in all our programs. The future is no longer dark and hopeless as it seems at the beginning of the pandemic. The future is bright.
Bonjour, my name is Félix-Antoine Véronneau. I am COVID-19 coordinator for Philanthropic Foundations Canada. PFC is a member association of Canadian grantmakers, including private and public foundations, charities, and corporations. In early 2020, when the pandemic started to spread with devastating consequences across Canada, philanthropic foundations were immediately compelled to respond to the crisis. Among them, 4 foundations based in the province of Quebec were looking for ways to increase their impact collectively. The Jaroslavsky, Molson, Saputo, and Trottier foundations turned to PFC to create the COVID Quebec Consortium, which would integrate a common funding mechanism. The first step that we took was to consult some 40 national and international experts in health and social development. Through this consultation, we observed that the impact of COVID-19 was substantially more severe in boroughs with higher poverty levels, greater ethnocultural diversity, and higher numbers of healthcare and essential workers. We realized that grassroots engagement, which is effective in limiting the spread of the disease and less costly than medical care, was largely underused as part of the response to COVID-19. The foundations, therefore, decided to focus on this key area. Beginning in the first wave of the pandemic, emergency cells regrouping community, municipal, and health stakeholders were formed in several Montreal neighborhoods. In May 2020, the Philanthropic Consortium approached the emergency cells in the most affected neighborhoods to map out local action plans to fight the pandemic. PFC also joined forces with the Foundation of Greater Montreal to manage these plans. Since then, 26 COVID-19 community action plans have been launched in the Greater Montreal area. Close to 200 community organizations are involved in implementing them. The Canadian Red Cross and the McGill University Health Centre are also key partners. Included in these plans is the creation of community brigades to raise awareness on health measures, testing, safe isolation of residents who tested positive for COVID-19, and support for the elderly and persons at risk. Now, the brigades are helping vaccination efforts and supporting the organization of clinics across the city. Community leaders are also mobilized to spread the word. This is allowing thousands of people to access vaccines. Over a year, some 700,000 citizens will have been directly reached and supported through the action plans. There are certainly many learnings to capture. This is why we're doing an extensive evaluation jointly with public health to be better prepared for future crises. They have realized that what we have done for COVID-19 through a coalition of philanthropic actors, community organizations, and the public sector could be replicated to tackle complex issues such as the environmental crisis, poverty, and social inequality. Thank you.
Action Nepal is one of the non-government organizations working in Nepal. Action Nepal has been providing support to disaster-affected communities of Nepal since last 2 decades. During the onset of COVID-19 pandemic, Action Nepal collaborated with 7 different rural and urban municipalities of the Hating district to provide the possible support that was possible from outside. Firstly, we coordinated with them to design the standard operating procedure for quarantine and isolations. Then we also helped them to draft the code of conduct for those who were living in isolation and quarantines. After a while, we realized that those quarantine and isolations were having serious hygiene and sanitation issue. They were not having enough water for the hygiene and sanitation related things. So we decided to provide them water facilities. We helped them to construct semi-permanent toilet. We helped them to construct semi-permanent bathrooms. And then we helped them to construct hand washing station and so many other wash-related infrastructures. Besides, we also provided them hygiene kits for everyone who were living in isolations and quarantine of those 7 different rural and urban municipalities. Besides that, we also coordinated with local government and some psychosocial counselor, because we realized that those who were living in isolation and quarantine were going through a hard time, and they might face some psychosocial trauma. So we decided to provide them psychosocial counseling. For that, we collected a phone number of all those who were staying in that quarantines, and we provided those phone numbers to our professional counselor, and they were literally calling them and they were listening how they are going through and what are their problems, how they are facing the situation and all, and they were providing the motivational kind of support to them during their stay in quarantine. Afterwards, we also provided them some recreational activities, some recreational things, for example, televisions, books, indoor gaming things, and so on. This is how we have been supporting the local government to overcome from the crisis, because this is something that we have never predicted, and this is not going to be end soon. So we are trying our best to provide the possible support that is possible from our side to the government of Nepal.